you are here for your cranial nerve exam. Great. We're really glad to see you at our clinic. And I suggest that we start right away. I believe that we have all of your personal data in the system, so no need to waste our time on that. How are you feeling today? I will need to ask you a few questions if you don't mind. Okay. So have you had any injuries lately? Especially the ones related to your head or neck? Any effect in your brain? Any concussions? Okay. Could you tell me more about that? Alright. What about your senses? Hearing, sense of smell, taste, your vision, also your tactile sensations. Have you noticed any changes in any of them? Anything suspicious or alarming? Okay. You sure? Please don't be afraid to tell me anything, okay? So when you're at the doctor's office, there's nothing really silly or embarrassing or foolish, so if you think it might be at least a little bit relevant, please do let me know. Of course. Great. Well, and then, have you had any colds lately? Any kinds of viruses? Nasal congestion, runny nose, sneezing, coughing, sore throat? Any symptoms like that? Fever? Any respiration problems? Okay, I got it. May I ask about your everyday routine? Do you work or study? Do you get enough sleep? How many hours of sleep do you usually have on a daily basis? Well, you know the answer. Yeah, at least 7-8 hours would be great. Have you had any sleep problems, any sleeping disorders, insomnia? Okay. Do you use any blue screen devices before going to bed? Yeah, all these factors matter, in fact. So you're supposed to air your room really well, because when it's too stuffy or hot, it's not good for your sleep. No use of all these devices at least 1 hour before going to bed, because they make your brain basically wake up and work harder processing all the information, and your eyes get tired pretty quickly as well. So there are actually multiple reasons why the doctors recommend. Exactly right, yeah. Okay, also regarding your diet, are you a vegetarian or vegan, or do you eat all kinds of protein and stuff? Any deficiencies that you know of? That's alright. Well, we're gonna test you really thoroughly today. First, I will tell you just a little bit information about your cranial nerves, how they function, how everything works, and how it's supposed to work, so that later it will be a little bit easier for us to test everything, right? So here you can see 12 pairs of cranial nerves, and let's start with the beginning. So olfactory, exactly, yeah, this one is really easy to guess. So it is actually responsible for your sense of smell. Yeah, here it is, right there. So that's the approximate picture of how it all looks like in your brain. Well, anyway, then we have the optic nerve, which is actually responsible for your vision acuity in the first place. Right, so your sight basically. And peripheral sight as well. Then we have two more nerves which are actually responsible for your eyes, which are oculomotor nerve, right? So it is actually responsible for your eyes movements, yeah? So the part motor in the stem of the word can give us some hints to that, right? Okay, and also blink reflex depends on this nerve, and also abducens. It's also responsible for your eye movements. Okay, so whenever we do the test, whether you following the light, following the fingers and like stuff like that, following some items, see how we can trace them with your eyes only without moving your head. These are to test your oculomotor and abducens nerves. Then we also have a trigeminal nerve, and on the picture you can see that it has these three kind of branches, so that's why it is called trigeminal, which is quite self-obvious. So this one is responsible for your face movements, for your facial sensations, right? Also for your jaw movements. So when we ask you to clench, unclench your jaw and stuff like that, we're actually testing this beauty. And it is also responsible for your sense of taste. There are actually a few nerves which also take part in your sense of taste. Okay, then we also have trochlear nerve. What do you think it is responsible for? Well, as you can see, so it's about eye movements as well, but more specific ones, yeah, up and down, and back and forth movements. Okay, then the other one, what we've got here, so we have already talked about the abducens nerve. Now, we also have auditory vestibular. I guess that the name is quite obvious itself, right? So it's more about your hearing and also your balance, right? So whenever we test your ears, it is also interrelated with your balance because of the vestibular apparatus, which is actually located in your ear, surprisingly. Okay, then we have obviously the facial nerve. I guess it's not gonna be that hard to see what it functions like, in what way it functions, and what its influences. Yeah, so these are your expressions, facial expressions. Yeah, like when we ask you to frown, raise your eyebrows, stuff like that, and also sense of taste. So basically, for sense of taste, we have the trigeminal, facial, and also vagus nerve, which are all responsible for that. By the way, vagus nerve, it also affects, like influences your heart rate and digestion, and it's the longest nerve, starting in your brainstem, and it goes down to your stomach. That's why it is actually responsible for your digestion as well. Yeah, it can even affect your mood. That's right. Well, and okay, so we also have hypoglossal, which is the word glossal tells us that it's about your tongue. Yes, it's about your tongue movements whenever we ask you to move your tongue to the sides and stuff. So this is exactly about that. Accessory. Yes, so this was more about neck and shoulders. Yeah, when we ask you to shrug your shoulders, we are checking exactly this, guys. Okay, and finally glossopharyngeal. So they are also responsible for your taste and swallowing. Of course, these are just the main functions listed here. There is way more to that, but it's like a short course for you. I don't want to overwhelm you with all these medical details. So, whenever you have some more questions in the process, please do let me know. Don't hesitate to ask, okay? Great. Well, I hope so. Wonderful. So, as we started talking about your sense of smell and taste, which means that we're gonna taste your olfactory nerve first. They pretty often start exactly with this one. Then we're gonna test your taste. It's gonna be very convenient, and thus we're gonna check your facial, vagus, glossopharyngeal, and trigeminal nerves all at once, basically. Okay, so are you ready? Good. Right, so I'm gonna get some cotton swabs, and also we have some testers which are actually supposed to help us see if you differentiate between different smells and tastes. So before we start, I'm gonna have a look at your mouth just for a moment. If you don't mind, of course, I'm gonna use a spatula for that. So please open your mouth and say ah. Good. I will press on your tongue really slightly. Please don't worry. Is it alright? Okay. Now, could you please move your tongue to the side? You can reach your inner part of your cheek with your tongue. Exactly. And to the other side. Okay, wonderful. Now what if I put the spatula back in? And please try to do the same. Try to move your tongue a little. Great. Now again. Okay, wonderful. So now please let me have a look at your nose. Good. Okay, amazing. Now could you please close one of your nostrils? Take a breath in and breathe out. And the same thing with the other one. I just want to be sure that you have that you don't have any kinds of nasal congestions and that you can breathe with your both nostrils the same way. The really good test to be able to check it is to take a small piece of paper or cotton or whatsoever, yeah, and also ask the patient do the same thing. So let's use this really thin piece of cotton for that. So please breathe in and breathe out, and so it's supposed to sway a little bit thanks to your breath, actually, to the stream of air coming out from your nostril. Okay, now the same thing with the other one. Okay, great. So okay, well, I basically don't really need the light for that, but just to see better if it's sweet or not. Just kidding. Okay, thank you. So your nose is working just fine. Okay, could you please relax and now swallow for me? Exactly, wonderful. Great. So now let's test your sense of smell and taste. So I'm gonna use some testers for that. I will put a few drops on this cotton swab. Okay, so there are a few kinds of scents, smells. They are, in most cases, pretty familiar, nothing exotic. So please just take a smell, give it a try, check how you can actually perceive it and if you can easily recognize it. Would you like to try one more time? You sure? Okay. No, we usually give only one try, one attempt. Just kidding, it's alright. You can take as much time as you need, but as a rule, you either know it or you don't. Peppermint it is. Wonderful. Great. Okay, good. Now I will take another cotton swab and another kind of tester. They're all in similar bottles, so nothing special there, no visual hints like colors or something. So the first one was peppermint and you were absolutely right about it. So now okay, great. Sometimes there can be also a bottle, so it can be easier just to dip the Q-tip in that, but anyway, doesn't really matter. Okay, so please give it a smell. Great, so what do you think it might be? Strawberry. Very recognizable one, quite easy to recognize. Okay, great. Well, honestly, I don't see the reason to proceed with checking your olfactory, but just for fun, let's do one more test. You know that our patients are usually quite entertained during this test, so who am I to? Okay, great. So, another beauty. Okay. Then once again, please give it a try. Not with your mouth, just take a sniff. Anything? What do you think it smells like? Coffee. Good job. Well, like I said, you did just perfectly fine. Great. Which means that your olfactory nerve is functioning the way it should. Great. Now, like I promised, your sense of taste. Open your mouth. You can stick out your tongue a little bit, but not too much. That will do. Thanks. Okay. So take your time. It's lemon, quite sour one. Right, sure, great, okay. And now let's take one more. That will do. Ready? So, what's your verdict on that one? Apple. Good job. Wonderful. Yeah, so usually some citrusy smells and taste flavors are used for that. Peppermint, coffee, like strawberry, very common ones. Yeah, so they are the most commonly used ones because they are very familiar for most people. Yeah, we don't usually use any kind of like pomegranate or some rare sorts of peaches and stuff like that, right? So something very recognizable. Okay, great. So I guess that we are done with this one. Well, of course, trigeminal, we'll keep on tasting it, yeah, because we'll keep on testing it, because it's not only about your taste, but also about your jaw movements, facial sensations and stuff, yeah. The same about facial nerve, vagus nerve and stuff. So most of them are actually responsible for a few functions simultaneously. Okay, sometimes even for a few different systems of your body. But that's just how it works. Okay, great. So now I guess we could actually test the group related to your eyes, your eyesight. If you don't mind, of course. Okay. First, I'm gonna start with light. Let me have a closer look at your eyes. Is it okay when I'm flashing the light, the bright light? Well, your pupils are supposed to react to it by contracting in size, shrinking in size, then they dilate back to their normal size. That's how it works. Okay, great. Now let me have a look at Good. That's alright. I'll be explaining everything. So look at the light, please, and blink. Okay. Keep on looking at the light. Blink. Perfect. So blink reflex. It's working just fine. Good. Okay, now please follow the light for me. With your eyes only, like I said. My previous instructions. So you've gotta look only at the light and with your eyes only without actually moving your head. Let's try again, okay? Please, no cheating. You're interested in fair results, not less than I am, so let's try again. I'm not gonna move it too fast, doesn't make any sense. Great. Wonderful. Now what I'm gonna do is turn off the light, okay? And we'll do the same kind of thing. Please follow the light for me. With your eyes only, like I said. My previous instructions. So you've gotta look only at the light and with your eyes only without actually moving your head. Alright. Good. Well, so now let me have a look at your pupils once again. After the light is back. Great, could you please look up for me? Okay, look up and look down. And look to the left and to the right. Wonderful. Now we're gonna test your peripheral sight. aka your side vision. In order to do that, I'm gonna move my fingers. You will let me know when they leave your field of vision, okay? But in order for this test to be accurate and medically correct, I will ask you to look at my nose, okay? Somewhere in the center of my face in your field of vision, which should be probably my nose. If you don't like my nose, just look at my face wherever you like. Okay, so I will just exactly, and you tell me when you don't see them anymore. Great deal. Good. Right. Okay. Good. Now I will use this bright tip of the percussion hammer. We're gonna use the hammer itself later as well to check how your tendons react. So it's a really important instrument, a tool for a neurologist. But for now, I will also ask you to let me know when this bright red tip leaves your field of vision, okay? Keep on looking at me. Good. Let's do it again. Now let's do the same kind of test, but with one of your eyes closed, okay? So just close your eye, please. I'm gonna help you a little. Okay, good. And also let me know when it leaves your field of vision. You sure? Okay. Let's try again. Okay, good. Wonderful. So, now a few more tests to see how your sight vision is functioning. I think I know the answer, but still, just to be on the safe side. Okay? Great. So, look at my nose, please. Tell me when you see my fingers wiggle on the either side. Either side. Good. Now please tell me which side it is as well. And one more thing, just let me know how many fingers you think I'm holding up. We are using a lot of different tests today, just some kind of a demo version of the cranial nerve exam for you. Of course, in many cases it can be much shorter, especially when it is not a scheduled cranial nerve exam, but when we are supposed to check how the cranial nerves are functioning after some kinds of accidents, injuries and stuff like that. So when we are only supposed to check very basic stuff and when we are short of time. Okay, so look at my nose again and tell me how many fingers I'm holding up. You're doing good. Now, regarding your vision, we also gotta test your vision acuity. I guess that in this case you're pretty familiar with the Snellen chart. It has different variations. It can be something like that, whatever, like this. I have quite a few ones. Okay. I'll ask you just to try to read the lowest line that you think you can still read, that you can still see really well, okay? Okay. Good, wonderful. Now I have this kind of a tool to cover one of your eyes, but for the previous test we just covered with your hand or mine, but yours will be more convenient, more comfortable, so I will ask you to do that. And now please read the same line. Wonderful. And now please cover the other eye. And the same line, please. I hope you haven't learned it by heart yet. Right. Good. Wonderful. Great. Now open your eyes, both of them, and please try to read the line below. Okay. Yeah, even if you make 2 mistakes, it is still right. It's okay, don't worry. And now your color vision possible blindness. So we have such beautiful Ishihara plates. Sometimes we can also show just different items. Ask what color you think they are. So, for example, talking about my stethoscope, what do you think? What color is it? Right, sure. What about my shirt? Okay. What about the medical shirt on top? Sure. What about the tip of the percussion hammer? What about the wall behind me? Great. Now let's have a look at these Ishihara plates. They can be in different variations. For example, they can be a little bit brighter with more of contrast and saturated colors that can be rather pale like this one. So let's go with a more challenging one. Alrighty, so please tell me if you can see anything inside this circle. It can be either some letter or maybe some number, maybe some figure, basically anything. Good. What about this one? And finally this one. Okay, now the one on the bottom line. What about this circle? Can you see anything? Okay, and finally the very last one. Good job. Good. Well, we are not colorblind. Congratulations. Okay. Sometimes we can also use some other kinds of cards to check your possible color blindness, to do some other tests, to check your peripheral sight in more detail, but it's not included in the basic one. Yeah, okay. Great. Now, I believe when your eyesight is tested, it's time for some hearing tests, right? So let's start with a really simple one. Let me when you hear me snip. My fingers. Okay, how many snips can you hear? Okay. Perfect. Now I'll whisper some words from one ear to another, just to see if you can actually hear this very quiet speech. In what range of sounds you can still hear. Okay, great. You ready? Right, please just pay attention. Okay. Summer. Ice cream. Coconut. Pomegranate. Apple pie. Dumpling. Glasses. 21. Pilots. 32. 55. Great. And now I will also make some background noise using my latex gloves. I'm not going to put them on, just use them for creating this noise, okay? Let's see how you can hear with some background noise. Added. Okay, good. Microphone. 62. 91. 47. Cranberry sauce. Pumpkin. Good job. You're really doing good. Now, another kind of test that we do is using tuning fork. I will put it right behind your ear. You will let me know when the vibration that it creates, that it produces, and the sounds stop when you actually stop hearing them, okay? It's not gonna be too challenging, I promise. Still hear it? Okay, let's try the other one. Just relax. Okay, how does it feel? Good. Yeah, tell me right away. And now I will put it on top of your head, somewhere in between, in the middle. Also, the same thing, let me know when the sound stops, the vibration disappears, and also, please let me know if you could feel it symmetrically on both sides of your head. No, just relax, it's fine. How was it? Great, thank you. Well, I believe that the ear exam, aka hearing test, is over too. Okay, now your reflexes. I promised I was going to use this percussion hammer one more time, so just relax. I'll start with your wrist. Great. Yeah. Yes, your hands or your legs, depending on where I hit, they're supposed to, yeah, to have this like impulsive movement. That's why it's actually called, like when it comes to your knees, it's called a knee jerk reflex. Yeah, so your leg is supposed to move a little, roughly speaking. Okay, now your elbows. Okay, and the other one. Perfect, wonderful. Now your knees actually. So to test your knee jerk reflex, I will ask you to put one leg over the other, bend some previously. Yeah, right. Good. Ready? Okay. Okay, wonderful. Now let me have a look at your feet. It's not necessary, it's not obligatory, but yeah, we can also check these. Yeah, okay. Wonderful. Everything's working just fine. Now, let's check your face. Facial movements, facial expressions, and like body movements in general. So, let me start with your jaw. I will also use this percussion hammer for a moment. My fingers, don't worry, I'm not gonna hit directly on your face. Perfect. Okay, great. Now, I will ask you to try to clench your jaw as strongly as much as you can. Don't let me pull your chin down, okay? I will try to put it down, pull it down a little. Don't let me do that. Try to resist me. Okay. Good. Now I will ask you to pop your cheeks. Okay. And do that again. Don't make close them. Okay. Great. Now, could you please raise your eyebrows as if you're surprised? Great. Now frown at me, please. Good. Wonderful. Okay. Now, please try to reach your shoulder with your ear, kinda, yeah, just to bend your neck, to tilt your head that way. Now I'll put my hands on the other side and try to resist me, okay? I will try to pull it down, you will try to pull it back to the straight position. And let's do the same thing, but just with the other side. Exactly. Good. And once again, resist me. Okay. Wonderful. I see that you're trying really hard. Good. Doing your best. Oh, of course. Okay, now please shrug your shoulders for me. Great. Now straighten both of your arms. Close your eyes and reach your nose, the tip of your nose, with your pointing finger. Let's do the same thing with the other hand, with the other arm. Okay, great. Good. Now I will ask you to... You're doing good, no worries. I will ask you to stand up and do the same thing. Straighten both of your arms. Close your eyes. Reach the tip of your nose. And with the other hand. Okay. Now, then one hand, reach the tip of your nose and then reach my fingers. exactly with the opposite. Okay, good. And now the other. Good. Wonderful. Okay. Now give me a high five. And to the other hand. Now I'll ask you to stand on one leg, actually. Good. And now stand on the other leg. And reach my hand. Wonderful. Okay, great. So your balance is just fine. Good. So, now please shrug your shoulders once again. And now raise them. And I will try to pull them down. Don't let me do that. Good job. Now please put your arms, your hands exactly like that. I will try to press on them, also to pull them down. Don't let me do that. Keep them this way. Resist me. Okay, perfect. Now I have this beautiful stethoscope, so let's check your heart rate and your lungs. Sometimes we do that at the very beginning. So since you said you had no problems with that, then I trusted you. So let's just do it, just in case, to be on the safe side, since you're here. Anyway, okay, good. So please breathe in for me. Once again, breathe in. Out. Wonderful. Now once again, breathe in and out. Okay, turn around, please. Breathe in and hold there for a second. Breathe out, and once again, breathe in, hold there. Breathe out. Good. So, you're actually doing great. Well, thank you so much. I see that you were trying your best. Also, thanks for being a really punctual patient. We appreciate it as always. And I guess that I'm gonna see you a bit later. Sure, whenever you come for your next checkup. Have a good one. Oh, of course. Well, for now you're perfectly healthy. That's right, so all your cranial nerves, like all that we have discussed earlier today, they all work just fine. So your heart rate is okay. Your digestion, I suppose, is good too, based on what you were saying earlier. Then we have checked your sense of smell, taste, your hearing, your vision, your balance, your coordination, your reflexes, your face movements and expressions, your body movements. So everything is just fine. I suppose you're happy with the results. Well, I hope so. So yeah, I'll see you later. Have a good one.